What do you do if you actually feel worse after seeing a pelvic floor physical therapist? My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist and founder of the Vagina Doc. And in this video, I'm going to talk to you about why more isn't always better when it comes to manual stretching and general exam of the pelvic floor muscles. Sometimes, and this isn't often, but I would say maybe a quarter or less of the time, someone actually does feel worse after their first pelvic floor physical therapy exam or when they have their first full treatment session. And there's a couple of common patterns that I've seen as to why. First, what I want you to know is don't panic. Do not panic. There's many reasons and explanations for why you might feel worse, and I'm going to get into that shortly, but just move through it. When people come in to see me, and I know other therapists as well, often they think like it's similar to a massage. They're like, oh, I can handle it, press, and whenever I say, do you need me to ease up? They're like, no. But they're not, more is not better, and here is why. But just know sometimes you will, it gets worse before it gets better, but in the end, once you move through what we call potentially a healing crisis, you will feel better. So the first is, and this, I was unsure if I was going to talk about this because it's not usually painful, but the muscles are in spasm, or they're tight, because there's actually underlying weakness, not only in the pelvic floor muscles, but the entire pelvic girdle itself, and which includes the hip. So the pelvic floor spasms and becomes really tight to essentially hold the ship together. And usually after that, the tissues will soften, but they'll tighten right back up. So when a person comes to see me the next time, they won't have that same, they won't be at the same level of tone as where we reached prior to that. Another reason, so that's not that common, because with pain, that isn't usually oh my gosh, I feel worse. Not usually, sometimes, but not usually. Next is that the pressure put through the pelvic floor muscles was actually too much for the resting or baseline levels of tone. When I see someone, I show them how the pelvic floor muscles attach to the tailbone, either directly or indirectly, and then also to the underside of the pubic bones in the front of the pelvis, or in the those bones in the front of the pelvis. And I say that when the muscles are too short or too tight, or they are the opposite, just really hanging there, that puts a force through the tailbone or through the pubic region, which is transmitted to the rest of the spine and the rest of the body. So sometimes, what that does is not only does it affect the musculoskeletal system, like the bones, but it also affects the nervous system, because our nervous system, the nerves and the spinal cord that start from the brain, go down. It's the brain, spinal cord, and then nerves come off of the spinal cord, and the spinal cord actually turns into several nerves. Though that tissue is protected by other tissues called, and the outermost tissue is called the dura mater, and that dura mater attaches to the tailbone region. So if you have a lot of stretch being pulled through the tailbone, or the opposite, really tight, so flexing versus extending the tailbone, that can create a nervous system response, which can be increased pain. It could be anything, weird experiences, like nausea, anything that people, if you've had a really aggressive massage, and some people could get nauseous and actually vomit, but that's not what I usually see in my practice. But massage therapists will talk about it sometimes. I mean, never say never, sometimes it happens, but yes, it can aggravate the nervous system or just be like, oh, a shock to the systems. The body like is in chaos and doesn't know like what to do, so it will go into protection. And what the most common things that people will tell me is they had a worse headache or worse pelvic pain or their back hurt, even worse. It depends on everyone's history. Now, why? And what I would say, it depends on your threshold, your nervous system's threshold for stimuli. Different conditions can decrease your threshold for stimuli. And stimuli could be anything. It could stretch, it could be shortening, it could be just any change. And what I most commonly see will be underlying gynecological issues like fibroids, endometriosis. It could be that someone's nervous system threshold has decreased, is lower because they just had a bout of radiation or anything, autoimmune things. Most often it's what I see is along the gynecological scale, like endometriosis and fibroids and cysts. Usually, though, like it depends. Like at first, it's the body's like, whoa, 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 what are you doing? What are you doing? This is new. But then things calm and it's fine. The other thing that I kind of referenced to is a healing crisis. Now, this area, the pelvic floor, depending on what your belief systems are, I don't know a ton about chakras, but this is our root chakra. We hold a lot of our emotions down here, or many people hold a lot of their emotions there. I know I do myself. Everyone has their own story and their own history. If you've had a lot of trauma down here and you had maybe a significant release with the pelvic floor muscle exam or any treatment, your body goes into chaos, like to reorganize itself, to heal. And then while you're in chaos, you feel crappy. And it doesn't necessarily mean it's the same symptoms, but you could feel like emotionally I feel down in the dumps. Everyone experiences it different. That's my personal experience. I just feel like I'm off. But once I move through it, usually, depends how much treatment I get. Usually it takes 24 to 48 hours, and then I feel much better than I did when I was seen. Now, the solutions for this, no matter what, is not less is more, much lighter. So pressure, like if I'm pulling and stretching the tailbone too much, even though you may not have pain, that doesn't give me the green light to keep pushing, because I need to know how your nervous system's going to respond. So the solution is much lighter. The second option is, okay, we start elsewhere, and then if we need to go there, because some people they have healthy tissue, yeah, things are tight, but there's other ways to go about it if the threshold there is just a little lower, and then we can revisit it, see what the other methods or tools did first. And that could be starting in the mouth, around the jaw, around the neck, and then checking in down there. And as we do that, we can either do this alongside that work. It's like indirect pelvic floor stretching through deep breathing, reverse Kegels, which is one way to do it is using the pelvic floor muscles directly. We could use breath work, we could use elongating the abdominal muscles. There's all different ways to get the pelvic floor moving with respecting a person's threshold. And I already mentioned breathing. So teaching someone how to breathe and being able to use the full diaphragm can have a significant impact on the resting tone of the pelvic floor muscles. So in this video, I know it was long, but I talked about potential reasons why a person may respond a certain way to pelvic floor stretching or manual therapy or even the exam. And the important thing is not to panic. Everything teaches us something. So let's say if I talk about a person that isn't, you know, it's under a controlled environment. And one time someone had seen hadn't had intercourse in a while, and they did that, and that was just like way too much all at once. And it wasn't necessarily a controlled environment. Not that I'm saying it wasn't safe, but it was too much on the nervous system and the pelvic floor muscles, and then they were so afraid to do it again. So at least it's like, okay, I would know, and I could say, this is, even though you might respond in a certain way, good thing we know in this environment, so you're prepared, and we can work to increasing your threshold so your body doesn't respond that way. I think that is it. So again, gynecological conditions, other histories like having an autoimmune response that affects just abdominal pelvic region. I did not mention bony changes, but that usually can happen whenever someone is going through cancer treatments. So anything that affects your spine sensitivity, because when we stretch the pelvic floor muscles, we are impacting the spine because of the attachments on the tailbone. So I hope this was helpful. The important thing is not to panic and just have an open conversation with your provider. They are trained to hear the responses, so they'll be able to tell you, you know, this is what this likely means. If there's any red flags, they will be able to spot it in the event that you should be seeing someone for further follow-up. So don't panic. It will be okay. Just move through it. And if you have any questions, again, contact your provider. If you are someone that is seeing me, have a conversation with me, and I'd love to answer any questions. And then thank you so much for watching. If this was helpful, please like. If you know anyone that would benefit from watching, please share. Otherwise, I will see you on the next video.